Today on Oxycodone News, we bring you the story of how a local snowboarder's usual day at the mountain turned into a painful tragedy that only Oxycodone could save. Here's a first-hand look on the story. Hello, I'm here with my patient. She suffered multiple injuries and is in a very painful recovery process. We're just going to do some assessments and ask her how she's feeling and see if we can administer Oxycodone. Hello. Okay. Oxycodone, often referred to as Oxycontin, is an opioid analgesic used as a strong pain reliever for moderate to severe pain. Oxycodone is taken orally by immediate or controlled release tablets, extended release capsules, or oral liquid formulations. It works by inhibiting ascending pain pathways in the central nervous system, increasing pain threshold, and altering pain perception. Prior to administering Oxycodone, the nurse will need to clarify all orders for the drug, assess the client's pain and need for the medication based on pain or sedation scoring, monitor the client's physical dependence or any substance abuse of the drug before subscribing. The client's intake and output should also be monitored for decreased urinary output or constipation. Allergic reactions like rash and urticaria should also be assessed for. It is important to assess for any CNS changes like dizziness, drowsiness, hallucinations, euphoria, loss of consciousness, and pupil reactions. It is also important that the client is offered some assistance with ambulation and that standard safety measures are taken.
Oxycodone should be stored in a light-resistant area at room temperature. Once administered, the drug should begin to work within 15 to 30 minutes and peak in 1 hour. Oxycodone is more effective if taken regularly rather than as needed, and the drug should be given before pain becomes severe. After taking Oxycodone, you should experience a decrease in pain without dependence on the drug. After long-term use, discontinue the drug gradually.
Overdose can be treated with Narcan, oxygen, IV fluids, or vasopressors. Assess and take special precautions for opioid-naive patients, substance abuse, accidental exposure of the drug, and respiratory dysfunction. Common side effects of Oxycodone include drowsiness, dizziness, confusion, headache, sedation, nausea, and vomiting, constipation, loss of appetite, and sometimes patients may even exhibit rashes on their skin. Some of the life-threatening side effects include bradycardia and respiratory depression. Do not take in the case of hypersensitivity, asthma, ileus, or addiction. Oxycodone is a drug that works great for pain, but do not take if you are pregnant, breastfeeding, are younger than 18 years old, have an addictive personality, have increased intracranial pressure or increased risk of heart attack, severe heart disease, renal or hepatic disease, or bowel impaction.
If you are caring for a loved one taking Oxycodone, make sure to avoid CNS depressants such as alcohol. Do not let loved one drive or operate machinery if drowsiness occurs. It is your responsibility to report any symptoms of CNS changes such as allergic reactions, physical dependence or withdrawal symptoms from extended use such as nausea, vomiting, cramps, fever, faintness, or loss of appetite.